Hello and welcome. My name is Felix Mahfoud. I'm working as a cardiologist at Saarland University Hospital in Hamburg, Saar, Germany. And we are presenting at ACC 2022 the 36-month outcome data from the SPYRAL HTN-ON MED trial. Hypertension indeed continues to be the leading cause of death worldwide, and poor adherence to antihypertensive medication highlights the need for additional treatment options. Radiofrequency catheter-based renal denervation has been demonstrated to safely lower blood pressure in sham-controlled trials in the presence and absence of antihypertensive medication. Durability with the Symplicy system has now been demonstrated in preclinical studies and in real-world results in thousands of patients included in the global Symplicy registry. However, and most importantly, data from randomized sham-controlled trials on the long-term safety and efficacy of renal denervation are scarce. This slide here shows the baseline demographic of the patients included in the SPYRAL HTN-ON MED trial. As you can see, patients were middle-aged, 54 years of age, most of them were male. They were obese with a body mass index of 31 kg per square meter, and they display the typical comorbidities of patients with hypertension. Here you can see the blood pressure data at baseline. You can appreciate that office systolic blood pressure was around about 160/100, so patients with isolated systolic hypertension were not included in that study. And 24-hour blood pressure, the corresponding blood pressure, was 152/100. We have shown that before. The study design of the SPYRAL HTN-ON MED trial, which was indeed a randomized sham-controlled trial, a blinded proof-of-concept study which included 25 sites in Germany, the UK, Austria, Greece, Japan, Australia and the US. Patients with a blood pressure of above 150 and below 180 and above diastolic 90 in office and a corresponding 24-hour blood pressure of 140/170 on 1, 2 or 3 drugs were included in that study. They were randomized 1-to-1 to sham control or renal denervation, and the sham control was indeed an invasive placebo procedure. We have follow-up scheduled at 3 months, 6 months, which was the primary endpoint, and thereafter patients were up-titrated with their medication. After 12 months, indeed, patients were unblinded and offered crossover at 24 and 36 months of follow-up to those that were treated with sham initially. This slide here shows the medication burden over time, and as you can nicely see, the renal denervation group had numerically, but statistically not significant, lower medication burden as compared to the sham group. This highlights that indeed, over time, there was an increase in medication and up-titration of drugs to get patients to target blood pressure. And again, that was numerically lower in those patients receiving initially renal denervation. Here are the main outcomes of our analysis. There were significant and clinically meaningful reductions in office blood pressure at 3 years, significantly more pronounced in patients receiving renal denervation as compared to patients treated with sham. The delta between 24-hour systolic blood pressure at 3 years between renal denervation and sham reached 10 millimeters of mercury. And probably more importantly, even so, the morning, daytime and nighttime blood pressure showed significantly larger reductions in patients treated with renal denervation as compared to sham treatment. Unlike antihypertensive medication, renal denervation demonstrated an always-on effect on 24-hour blood pressure, as shown here. You can see on the left-hand side the renal denervation group, on the right-hand side the sham group. Dark blue is baseline, light blue is 3-year follow-up. And when you look at the data over time, you can nicely see and appreciate that renal denervation demonstrated again an always-on effect out to 3 years of follow-up. So indeed, the hour-by-hour blood pressure was significantly lower in patients receiving renal denervation as compared to sham-treated patients. This slide shows an important outcome of this analysis. Indeed, in clinical practice, we try to get patients to blood pressure control, and here we counted the patients that achieved a 24-hour systolic blood pressure of below 140. And as you can see, that number was almost twofold higher in the renal denervation group, 84%, as compared to sham control, 44%. The safety profile of the procedure was excellent indeed, as shown here. There were very few adverse events that occurred over time. 1 all-cause death in the sham group, 1 hospitalization for hypertensive crisis, and 1 stroke occurred in the denervation group. But importantly, There were no new renal artery stenosis detected. There was no deterioration of renal function observed in this cohort of patients. Some limitations are important to be considered. Blood and urine testing assessed medication adherence at discrete time points, but adherence over an extended period of time is, of course, uncertain. Patients' exercise, diet, or smoking habits were not captured in this analysis. And blood pressure control worsened overall in the US and around the world during the COVID-19 pandemic, which may have impacted blood pressure results herein. However, in-person follow-up visits were performed despite pandemic restrictions. Let me conclude by saying that radiofrequency renal denervation compared to sham control demonstrated clinically meaningful and statistically significant reductions in blood pressure independent of concomitant antihypertensive medications out to 3 years without any safety issues. Given the long-term safety and efficacy, renal denervation provides an interesting adjunctive treatment modality in the management of hypertension. These long-term results are specific to the investigated device, which is the SPYRAL radiofrequency catheter, and may not be generalizable to other renal denervation devices. Thank you very much for listening, and for further details I refer to the publication that appeared online in The Lancet. Thank you.